Lessons learned from coronavirus hot zones. Tonight, we are catching up with a Valley doctor and nurse who have dedicated the last few weeks to fighting COVID-19. They're just now back to Arizona after working in New York and New Jersey. And ABC 15's Sonu Wasu tells us how they think Arizona can help save lives.
They sacrificed time with their families and their own health to work on the front lines of a pandemic.
It was insane. We were coding people. People were dying.
Nurse Marcy Guest and Scottsdale intensivist Dr. Greg Margolin, both witnesses to a lot of suffering and death inside East Coast hospitals. It's changed the way they look at modern medicine.
Clinging to the old way of treating patients with respiratory failure is a failure.
Dr. Margolin was seeing how the novel coronavirus did not just aggressively attack a patient's lungs, but also the vascular system or blood vessels by forming strange clots in small arteries that could lead to major organ damage. Now, with this new knowledge,
we'll get better and better at managing it. And so the mortality rates will go down.
Both the doctor and nurse tell me they were surprised to step off the plane and see many people not wearing masks at the airport in Arizona.
It feels like we're not being good citizens because the masks aren't necessarily to protect us, but to protect others if we have it and we don't know.
Concern and compassion for others, something that comes easy to a nurse who has literally held the hands of those dying from COVID-19 when their own families were not allowed inside the hospital to say goodbye.
When that happens and it's done and they pass, you leave their room and you have to go back on to the next person who needs you to be present for them, who needs you to be 100% on your game.
Always on the run, exhausted and emotionally drained.
There are days where you don't even know how to process what you've seen and what you've been through.
But also passionate to help save lives.
Are you willing to go back and work on a COVID floor here in Arizona now?
I would absolutely do it again because our patients need us, our fellow nurses need us.
As Nurse Guest and Dr. Margolin get ready to head right back into those front lines, they're hoping Arizonans will learn from mistakes of the past.
Memorial Day didn't help much. I think the town went a little la vida loca.
But also from states once coronavirus hot zones that made progress to get their case numbers down. Sonu Wasu, ABC 15, Arizona.